Hello everyone, my name is Pooja Pandita and I've completed my master's in medical microbiology. And from the past 1.5 years, I've been associated with academic writing and academic research helping students overseas. So today we'll be discussing a very interesting topic, which is disease model of addiction. So to begin with, we'll discuss what disease model of addiction means and how it compromises the health and safety of the individuals. As we know that addiction can be related to diseases where biological, environment, or social factors are involved and will contribute as a source of addiction. The disease model is related to an abnormal condition that causes discomfort, distress, and dysfunctioning. So as we know that addiction is a disorder in which the people undergoing addiction faces a lot of troubles in terms of discomfort, stress, psychological stress, which ultimately leads to depression. And depression is a disease. So in this way, we can say that addiction can lead to various diseases like depression and anxiety. And this disease model of addiction will enable us to study and gain a deep understanding about how the interventions can be designed for minimizing the prevalence of the addiction and associated diseases. The affected individuals are often labeled in the society as addicts, which creates a gap and space for model stigma and associated discrimination. These existing labeling factors keep them away from developing self-control and minimizes confidence and self-esteem. So in this way, this addiction ultimately leading to various diseases will disable the individuals to perform their everyday activities, and they will eventually lose confidence and they will begin to remain socially isolated. These all contributes and increases the psychological health burden among the addicts. So therefore, there is a need to provide equality and justice for the rights of the children, especially to the children population who are addicts and need more support from the healthcare professionals. So this presentation will discuss the conflicts of diseases and addiction existing in the society and to create opportunities to meet their needs and life care goals. So this disease model of addiction will surely help the healthcare professionals to shift their focus from just not curing or minimizing the prevalence of addiction, but at the same time providing interventions that will support and neutralize the diseases associated with these addictions. So further, we'll discuss why there is a need to study the disease model of addiction. There is a share of parents who are reporting worsening mental health among their children, especially to the ages belonging to 5 to 12. And these are the reports from the past 2020, which was conducted by Panchal et al. A study was conducted, and the results show that around 22.1% of the children shows overall worsening of mental or emotional health. Around 4.4% of children shows elevated symptoms of depression. Moreover, 6.3% of elevated symptoms of anxiety are seen among children belonging to age group 5 to 12. And 9.2% of the children shows also elevated symptoms of psychological stress. So these increased prevalence of mental health issues, adding the psychological health burden among the children as well as among the other age groups also, is that there is a need to study the disease model of addiction, as addiction resulting in depression can trigger various mental health issues, which are discussed clearly in this graph. So to minimize the increasing prevalence of psychological disorders, there is a need to study the disease model of addiction. So what are the risk factors that contributes to addiction, especially among the children as well as other age groups? We know that neurological changes in the birth that the addicts cannot stop using drugs, which leads to a higher relapse rate among the affected individuals. We also know that drug abuse is one of the reasons for addiction that will hijack brain functioning and turn it more vulnerable to social and environmental factors. We know that the person who is an addict, it can be either a drug addict, alcohol addict, or smoking, or any tobacco addiction. So these all addictions will hijack the brain functioning and makes the person vulnerable to various other illnesses, in which depression and anxiety are the two common issues. There are other environmental factors, including family history, background, social status, and beliefs, as well as medical history. So these are also other environmental factors that contribute to addiction. For example, if a person or a child belongs to a low socioeconomic background, he's more vulnerable towards drug addiction because he is not literate, he has not access to receive adequate education, he cannot afford to go to school. Moreover, he is also facing lack of employment as well as lack of housing. So all these social factors are contributing and creating risk factors for addiction, especially among the people belonging to low socioeconomic background. So further, we can discuss what all are the other genetic and environmental factors that are contributing towards addiction. Addiction, as we know, is more often related to chemical reactions that are occurring in the brain in response to a drug. And this response varies from individual to individual, and that is why different individuals show different kind of response towards drugs. The genetic reasons that are contributing to addiction includes hereditary. An individual with a family history of smoking is more vulnerable to addiction and then as compared with the other people who doesn't have a smoking history. So we can say that hereditary or these genetic factors contribute significantly towards addiction, which cannot be overcome. Individuals, especially belonging to young generation, are more addicted to the drug, in which peer pressure plays a very important role, including gambling and poverty as well. Because the people, if a child is having a friend who is an addict, there is more responsibility that this child will also shift towards addiction because of peer pressure. As well as poverty is a very essential environmental factor contributing towards addiction, as these people are also affected by family violence and family disturbances and lack of communication between the family members, and this leads to increased psychological stress, which ultimately brings the children towards more